Think, okay, this Hangout on A is
Smile.
now live. Yes, everybody smile. We're actually live. Okay, so hello everyone that's watching. This is Twig. Twig stands for This Week in Global Health. This is your one-stop shop for the good, the bad, the ugly, and everything about global health. This week we're going to be talking about climate change. This week is actually in New York right now is the UN Climate Summit 2014. So this was a good time to talk about climate change. Before we carry on, I'm going to ask the panel to introduce themselves. We'll start off with Jessica.
Hey everybody, I'm Jessica Taff and I'm coming to you from the Washington, D.C. metro area, and today I'm going to tell you a little bit about what we can expect with climate change, the weather-related events, and how this actually affects what we can expect on the health side of things.
Thanks very much, Jessica. Okay, Christy, where are you and what are you going to talk about today?
I'm Chris Ronson. I'm coming to you from San Francisco, California, and today I'll be covering a little bit of the effects of global warming as well as going over some online courses that people can use to brush up on the topic.
Thanks, Christy. Okay, and Christy, I mean, we talked about this last. What's the time on that side of the world at the moment?
It is 11 a.m., so
11
I'm
a.m.
way
Okay.
behind you guys.
All right, and it's 7 o'clock here in Dublin. The reason I'm saying that is that if people are watching this on YouTube in the future and they're thinking, oh, well, what time is this thing on live? I'd like to watch live and participate. Okay, well, now you know if you're on the west coast of the US, it's going to be 11 in the morning. If you're here in Dublin or London, it's going to be 7 o'clock at night. If you're in Geneva, it's going to be 8 o'clock. And if you're in New York City, I think it's about 2 o'clock. So that's just a quick advert about the live show if you're watching this in the future sometime on YouTube. Next up, let's hear from Lucia. Lucia, who are you, where are you, and what are you going to talk about today?
Hi everyone, I'm Lucia Fernandez. I'm talking to you from Geneva, and I will be talking about the indirect effects of climate change on health through its impact on other sectors.
Okay, thanks very much. And Yasin, could you talk to us? Where are you and what are you going to tell us about today?
Hi, I'm Yasin. I'm from Montreal, and I'll be talking about youth involvement in climate change policy.
Okay, and Yasin is the first person that we've had broadcasting from within inside a car. So, let no one ever accuse us of not trying to
You
be
know,
innovative and do things differently.
Greg, you should know this about everybody, and in global health you have to be flexible and adaptable, so I think that's a perfect example right
Resourceful.
there.
We're very
Exactly.
And resourceful.
We are not afraid of doing things differently. Anyway, if you are watching the show live, please interact with us. You can send a tweet, and we'll be following the tweets live, and we'll answer questions that you might have at the end of the show. You can tweet us at hashtag Twig, Twigh. You can also put comments in the comment box below this if you're watching this on Google Plus at the moment. If you're watching this on YouTube in the future, write comments in the comments underneath the video. We'll respond to those too. Quick message. Sign up for the newsletter if you would like to get the show notes from these shows, right? So as the different members of the panel talk, they're going to be making reference to web pages and resources online, et cetera, et cetera. We send out a newsletter with the show notes of every show after the show to everyone that signs up. And in that, you'll see all of that kind of detail. How do you get to this newsletter? Well, if you look at the show notes, if you look in the description below this video, you'll see a little link that'll take you to a form. You fill in the form, you push submit, bada bing, it's done. Okay, moving right along. Just a quick advert. Next week, we're going to be talking about health systems. So if you're interested in health systems, tune in. Let's get on with this show. Jessica, can you talk to us just very broadly, climate change, what's the big issue? What is climate change, global warming, et cetera, et cetera?
Sure, absolutely. Okay, I'm sure everyone's really familiar with the idea of global warming. But really, what are we expecting in terms of temperature rises? How much? So it's projected that temperature rises could go up about 5 degrees Celsius. However, people are definitely focusing on not exceeding 2 degrees Celsius, and that's where efforts are targeting. But people also tend to forget about the other changes in the climate system that happen besides the temperature changes. For instance, by the 2090s, climate change is likely to lead to more areas that are affected by drought, and actually we're expecting to have more frequent and longer droughts, longer by sixfold. Additionally, we can expect heavy rainfalls, heat waves, and storms. These are going to be more frequent, more intense, and longer in duration. And basically, you can just expect that we're going to have more extreme climate events in the future. This is just going to happen more frequently, and it's just going to be more intense.
Okay, very good. Thanks very much. Now, I'm just going to say something quickly, and I won't be too long about this, because the rest of the show is really going to be about climate change and health, right? So we're going to be looking at the health effects of climate change and what we need to do to be ready for that. There are people out there that argue that, well, climate change isn't really real, or they used to, in fact. That group of people is dwindling. And I get really sick and tired of the media portraying this as a controversial issue. It's not controversial. right? There are scientists out there that say, well, climate change isn't real. There's also scientists out there, believe it or not, that claim that HIV doesn't cause AIDS. Well, that's not true. We don't say it's controversial. It's not controversial. There's scientists out there that say that there isn't.
No, there's evidence.
Yeah, there's scientists out there that say there's no link between smoking and lung cancer, and one can just imagine where they get their research funded from, right? Climate change is happening, and it is a consequence of human activity, and it's not controversial. The body of evidence behind it is overwhelming. So let's just draw a line under that, and let's start talking about what we need to do, both to mitigate climate change itself and to get ourselves ready to deal with some of the effects thereof. Okay, so that's my little soapbox over and done with. Jessica, can you perhaps highlight just very broadly what some of the big issues around climate change and health are?
Sure. Okay, so this is actually a great time to talk about the effects of climate change on health, because the WHO just released an updated risk assessment of the effects of climate change on selected causes of mortality. And they estimate that 250,000 additional deaths are going to occur that are due to climate change between the years 2030 and 2050. So things like rising temperatures can lead to heat exhaustion and stroke, especially this affects the elderly. And you can have things like storms and floods, which will increase the risk for waterborne diseases that cause diarrhea, and also diseases like malaria and dengue that are carried by mosquitoes. And air pollution can lead to a number of chronic conditions. And then the final thing to think about is that climate change can cause shifts in animal populations, which puts us at greater risk for emerging zoonotic diseases.
Okay, very interesting. And a small little factoid, more people die because of lung disease related to air pollution every year than from HIV, TB, and malaria put together. All right, so that's a little factoid. Moving right along. Christy, talk to us about how climate change and the effects of climate change on health will affect people differently in different parts of the world.
Okay, so we've got some research that's been done over the last couple of years, and the research is telling us that by 2030, sub-Saharan Africa is projected to have the greatest burden of mortality attributed to complications due to climate change. South Asia is also slated to be the region whose general health, not just mortality, but health in general, will be the most affected by these changes in climate and global warming. And we're also looking at and can anticipate dramatic effects on coastal cities because of rising sea levels due to global warming.
Right. Okay. Very, very interesting. And Christy, could you just talk to us a little bit about that? Because we know, okay, sea level goes up, and we're not going to get into all the science behind why that's the case, but it goes up with this climate change. How does that affect health? Like a little bit more specifically.
In a broad sense, rising sea levels and increasingly extreme weather systems that are going to be a cause of this climate change will have resonating effects on global populations, as more than half of the world's population lives within 60 kilometers of the coast. People may be forced to move. There's going to be a heightened severity of weather events, which are more destructive on everything from actual structures to infrastructure. And of course, there's going to be huge consequences and repercussions in global health in that sector.
Right, and of course, and in fact, we should at some point do an entire episode on the detrimental health effects of people moving, people being displaced, and it affects everything: maternal and child health. It affects infectious disease. It affects mental health. I mean, the list goes on, and that's a whole discussion in and of itself. But certainly, rising sea levels will be a precipitant of that. Lucia, okay, we've touched on a few things, but Lucia, could you kind of talk to us a little bit about some of the less obvious health consequences of climate change?
Of course, yeah. Besides the effects that Jessica and Chris have explained, climate change is going to affect nutrition severely. So those areas which are right now suffering the most from food insecurity are going to be badly affected by climate change. For example, some African countries will have like 50% less production of crops by 2020, which is in 6 years' time. Another of the effects is in working capacity. Increasing temperatures are going to make the conditions that workers work in harsher and more difficult, and this is going to lead to a reduction of about 20% in working productivity. Another effect linked to the sea level rise is that the small island states are already seeing their land flooded, and they are already migrating to other areas. This, as you said, is going to cause like a huge health impact. And this is because sea level rise is intruding in these small island states and polluting and contaminating freshwater resources.
Right,
so this
absolutely.
is some of the most important impacts of climate change.
Yeah. And Lucia, could you perhaps just expound a little bit more about infectious disease? So it's it's been alluded to, but just tell us a little bit more about infectious disease and how that will be worsened with climate change.
Yeah, definitely. So vectors are really sensitive to climate conditions as temperature, humidity, So we know from climate change impacts that these patterns of rainfall, patterns of temperature are going to change. So this is going to lead to these vectors to move to other areas. These are areas where people were not previously exposed to infectious diseases and they don't have immunity. So there are going to be about 2 million more people exposed or at risk of dengue, for example. And also we are expecting more outbreaks of malaria in areas where we didn't see that before.
Right. Very interesting. Now, of course, we've established a few things. Yes, we believe climate change is real, firstly. Fine. Secondly, yes, we believe it's going to impact on health, and the impact on health will be detrimental. In actual fact, in recent times, there's been some interesting comments coming from the Director General of the World Health Organization, Margaret Chan, kind of talking about how important climate change is as a health issue, and we'll actually have some links to some of her comments in the show notes if you subscribe to that. But of course, the next question we have to ask is, what do we do? All right, and that's a whole discussion. We could talk about that for hours. But Jessica, perhaps you could just talk us through some of the sort of broad strokes. What do we need to do about climate change, and what do we need to do about climate change as it pertains to the risk of health?
Sure. Okay. Well, the first thing is mitigation. I mean, the whole idea, let's be more green. Let's be more mindful of our own carbon footprints on what is essentially our shared globe. We can also be more adaptable. So adaptation is very important, and there's a lot of ways we can do this. For instance, as a community, as a global community, if we develop early warning systems to detect climate-related disasters, and this includes vulnerability assessment, response planning. But another way of going about this is improving the links between ministries of the environment and ministries of health. And by doing this actually ties into another very important response, which is health system strengthening. And then the final thing that we can do is improve training of medical personnel and improve capacity of people to respond to specific climate change related threats.
Right. And this is just a quick advert for next week's show. Like so many of these big catastrophes that we see in the world really come down to weakened or weak or inadequate health systems in the places where, and if we look at Ebola virus, the Ebola virus epidemic as it is today is just such a crazy mess. Partially because of the fact that the health systems that were in place in the countries affected weren't ready for that sort of thing. And we should have been thinking about this years, if not decades ago. The same thing applies to global warming or climate change, because we need to think about climate change, not just global warming. Things might get cold at some point, right? We could talk about what people call a snowball planet at some point. But anyway, that's a whole other discussion.
Right. And
so,
Greg, I think it's important when you're saying about how are we going to respond to this and using Ebola. I mean, we can think about the tsunami that happened in Asia, and it's so important to have a quick response when these disasters happen. And that's what this is telling us. We can expect more frequent extreme disasters, and we need to be on the ball and responding to them, to think about how are we going to prevent all the cholera or the dengue. So if we can get that in place as soon as it happens and be prepared for it, then we can probably avoid some of the other health-related effects.
Right, and so I suppose the key words here are vulnerability assessment. So understand at a national level, what are they vulnerable, where are the risks, and then response planning, like in advance, get things ready up front.
Absolutely. And you know that it's a preparedness month for September.
Is that true? Okay.
It is.
Next week, I'm going to ask Yasin. He is a special guest tonight, and we're glad to have him here. Yasin is from the International Federation of Medical Students Association, so it's quite a mouthful. And so I'm going to ask him to tell us a little bit about who they are, what they're doing, and they're actually very involved with the whole climate change and health issue, so we want to hear about that. And he's also been involved with some other youth-related responses to the climate change issue. So, Yasin, could you talk to us?
Yes. Firstly, I'd like to express why climate change is such an important issue for youth. Climate change is something whose effects we see many years down the road. So there's a concept of us taking action now or not taking action now impacting future generations. And this intergenerational equity is why so many youth groups find it very important to have an opinion on climate change and to work on climate change. And the health aspects of climate change are very crucial and touched upon by a lot of groups. The International Federation of Medical Students Associations, IFMSA, has been working on it for a number of years, both in terms of capacity building and in advocacy at UNFCCC meetings, so meetings of the body that is responsible for the Kyoto Protocol, at other meetings such as WHO, where climate change and health specifically get discussed, and for example at recent UN meetings that have to do with sustainable development and climate change. Just at our last General Assembly in August, there was a workshop aimed at building capacity of IFMSA members on that topic, so that they can then spread that information onwards within their countries.
Okay, sounds interesting. Yeah, carry on, please do.
I wanted to highlight also some other work that's been done by other groups. For example, the WHO itself has been engaging very closely with youth prior to its Climate and Human Health Conference last August. And both IFMSA members and youth from all around the world have been joining up electronically, providing input into that conference so as to get their voices heard. And lastly, I just wanted to mention also the WHO simulation which happened in Copenhagen at the beginning of August, which also had to deal with the theme of climate change and health, and bringing together dozens of youth from around the whole world to discuss that topic, and ending up with a resolution of youth and youth priorities relating to climate change and health. Discussing all of the important issues that we mentioned here, disaster risk reduction, the central involvement of a body coordinating climate change and health, being WHO in that case. And
Yasin,
yes.
Can I ask you a brief question? So I was just thinking, I mean, since you're in the youth involvement, do you think that because this is something as a younger generation that we're going to have to be dealing with much more than people in their 50s and 60s, that this is why the younger generation is so active about this and passionate about it?
I think this is definitely one of the reasons that motivates the younger generation. I think there's other systemic issues with the way we deal in political terms of long-term problems. Long-term problems are never the person in place's issue. They're always someone else's problem. Whereas youth can have that long-term vision, which is outside of political bounds as well.
Yeah, that makes sense.
I can see that. It makes sense.
Absolutely. Yasin, I wonder, while we've got you here, because we don't have you here all the time. This is a little bit of an opportunity that we've got. Would you tell us a little bit about the International Federation of Medical Students Associations? Because in each show, what we try to do as a kind of a side objective of each show is try and profile some of the stakeholders in the global health space, so that people know who's out there, who's doing what, who they are, et cetera, et cetera. So let's just give us a kind of a 30-second or 10-second overview of the International Federation of Medical Students Association.
Okay. To be brief, the IFMSA is an international student organization bringing together medical student associations from around the world. So 124 associations representing 117 countries are within the organization, which is now 63 years old. So it was founded back in the days when all the UN agencies were being founded in the 40s and beginning 50s. And it's been working with UN agencies and with other international organizations advocating for health issues.
Okay, and I've often come across them. I'm very impressed with the work they're doing. So here's a little bit of a shout out, to the International Federation of Medical Students Associations. We love you guys. We love what you're doing. Keep up the good work, and let us know if there's anything else that you do that we can profile on this show. We'd be more than happy to. Right, Lucia, back to you now. There's been an interesting competition. There's been some interesting ideas that have come out around innovative kind of approaches to climate change and health. Could you tell us about one of those?
Exactly. There are many competitions going on around sustainable development, climate change, and mitigation. But there is one specific one run by ITU, which is the International Telecommunication Union, which is on smart cities and climate change. And there is a really interesting idea coming from Egypt, which is about how to help African poor households to use solar power. So this person is sending an idea as like a prepaid, so you pay with your mobile phone, you pay through an SMS, you pay for the energy you want to consume, and you also pay for the device slowly in small fractions so that you are able to afford it. And this comes because in Africa, every 24 seconds there is someone who dies from kerosene poisoning. Wow. So it's extremely related to health as well.
Wow, I did not know that. Every 24 seconds someone dies from kerosene poisoning. That's unbelievable.
Wow.
That's absolutely phenomenal. Right, thanks very much for that, Lucia. Christy, there's going to be people watching this, and they're thinking to themselves, I'd like to know more, I'd like to learn about this. A 10, 15, 20-minute conversation on YouTube isn't enough. where can they go? Can you just tell us about some free courses, some free online resources that people can tap into to learn more?
Yes, climate change involves pretty much every global health discipline out there, from politics to economics to agriculture, nutrition, everything. And so it's very diverse, and it has long-lasting effects. A lot of people have gained sort of an interest in climate change and in global warming. So we've pulled together a list of online courses, some of which are free, some you can pay to get a certificate, and it's still very low cost. The first one we're going to look at is global warming. It's the science and modeling of climate change. It starts in just, I think, just under a week, September 29th. That's available on Coursera. The links to all of these classes are going to be available in our show notes. So if you sign up for the show notes, you can go ahead and we'll have a list of about 6 to 7 different courses that you can look into. The second one that we've got is the World Bank, Why a 4-Degree Warmer World Must Be Avoided. That's also available through Coursera. And then one that I highly recommend is the UN course on climate change, and that bit.ly link is going to be available in the show notes as well. So those are all places you can go as a resource to learn more, engage with other students, get new perspectives, and sort of educate yourself on an emerging issue.
Okay, thank you, Christy. Now, for those of you that are watching live, don't go away. Stay tuned. We're going to stay on air. But for those of you that are watching this on YouTube, the show is going to end in just a couple of seconds. We want to just invite you to click on the link that's in the description below this video if you want to sign up to get the show notes. The show notes will have all the different URLs and links, etc., and all of the information that we've talked about is in the show notes every week. It also tells you about where it is that you need to go to watch the next show, right? Because this is we set up a new Google Plus event for every single show that we do. Hopefully soon we're going to have our own webpage. Oh, incidentally, we're also soon going to have a podcast, so you're going to be able to get these episodes as a podcast. But thanks for watching. Send your comments, questions, thoughts, etc., to in the description below. We'll respond. Take care. Don't ever change. Don't do drugs. Always do your best, and we'll see you next week for a discussion on health systems. Fun will be had. Okay. Bye.